Hello, and welcome to GAPNA Chat, an official podcast of the Gerontological Advanced Practice Nurses Association. GAPNA Chat provides interviews and discussions with GAPNA leaders and members of the gerontological healthcare community, and will focus on advocacy, policy, education, professional development, research, and clinical care for older adults. In this special episode, the current president of GAPNA, Dr. Jennifer Kim, and immediate past president, Dr. Natalie Baker, wrap up the year by discussing GAPNA's 2022 accomplishments and the strategic goals for the 2023 year. This episode was recorded on January 6, 2023. We are pleased to present this special episode of GAPNA Chat.
Well, Happy New Year, Natalie. It's so great to see you.
It's so great to see you, Jenny, as well. Happy New Year's.
Oh, I hope that you and your family had a great holiday season.
We did. You know, it's always good just to have a little bit of a break from, all of the craziness of the world. How about you?
Yeah, a very quiet holiday season, but that is exactly what I needed. It was a great time just to spend with family and friends. And 2023 has started off to be really busy, just as busy as 2022 was. So it's good that I had that break. And I'm really glad that we have time today to sit down and talk about GAPNA and what we've been doing in 2022 when you were president, and then what we are continuing to do and what our goals are for 2023. But I guess I would love to hear from you. Just a recap of some highlights from your presidency during 2022.
Well, Jenny, it's great. GAPNA is probably my favorite topic.
Mine too.
You could have called me on Christmas Day and I would have stopped to talk about GAPNA. I love my peeps. And there were just so many things that, happened and are continuing, moving forward. And it's the thanks to all of our members and energetic board. I just feel like we very much are a member engaged organization. So while I may have been kind of, quote, the face of GAPNA, during a year time period, it definitely wasn't just me out there doing. But I would, say that there are several things that, just rise up to the top. One is the DEI statement. We came out with a DEI statement back in probably late spring. We put it out on the website. We asked members for input, and then we incorporated that input and then got that posted on the website probably around June. I think that was very important for us to do.
Okay.
Another thing that I know that we probably will talk about during this session is the strategic goals. We came out with our House of GAPNA. We brought in some previous and current leaders within GAPNA, as well as the board, back in March at the pharmacology conference. And we, talked about, what is our purpose? What is our vision? What do we want to focus on over the next 3 to 5 years? And we just continued to move things forward. Like, for instance, the gerontological specialist certification that now, can you believe it's been 5 years?
I can't.
We had a former mentee that was in the GAPNA Leadership Institute. She wrote a review book for that exam, and we finally came out with, quote, the review book that everybody wants. And that was definitely very exciting. Our research committee did a wonderful webinar on how to submit a winning abstract. We had another position statement that was released. Toolkits updated. Gosh, Jenny, it's just so much.
It was a busy year.
It was. And it continues to be, doesn't it?
It does. It's funny because one of the highlights for me of 2022 was that review book. that was published. And I think one of my favorite memories was being at the conference and hearing, right at the beginning of the conference, that almost all of them had sold out. So that really tells you not only how much it's needed, but just what a great product it is. Also so excited to see that Megan Pratt, who was the editor-in-chief on that, and that was her GAPNA Leadership Institute project. It's so exciting to see that now Megan and another fellow from a previous cohort, they're now acting in a leadership role in the GAPNA Leadership Institute. So that's encouraging to know that this Leadership Institute really is forming the leaders that we need within GAPNA.
I agree. And, I remember, as I know you do, just 2 or 3 years ago when the concept came up, do we want to do a leadership institute? And we decided to, hey, let's do a pilot and see how it goes. And then COVID hit, but we continued that momentum and we've learned from it. And so starting, this newest or this current cohort, we decided to go from a 12-month time period to an 18-month time period to give our mentees more time for their projects. And yeah, that was a special memory for me too, just knowing that, wow, we sold the first shipment of books within a matter of hours. But they are still available on the website.
I bought my copy because I wanted to get one before they were all going to be sold out. And I love it. It's even just a great refresher for me. It's a great resource for me, even though I've been an NP for quite a long time. But I love that. And then, it's funny, something that really drew me to GAPNA when I became a member, I think it was 2002, is that I felt as somewhat of a baby nurse practitioner, I just really felt the support and the mentorship and just the friendliness of the NPs that were in leadership there. And then all the other members. And I think that's something that's really special about GAPNA is that we do see our younger members as being the future and that we want to mentor them. And something else that's really exciting that this year that's coming out of the Leadership Institute is one of the fellows, her project is creating a pre-conference for APRNs who are new to long-term care. And we know because our members tell us this is such a huge need. And I love the fact not only is GAPNA meeting that need, but it's actually going to be spearheaded by somebody who is this new emerging leader. So for me, that's really, really exciting.
I agree. And, Jeannie, that's another example of you don't have to be the president. You do not even have to be on the board to make lasting impacts within our organization and helping fellow APRNs who are taking care of older adults. Every member, they kind of leave their fingerprint on our organization, the momentum. I think about Michelle Talley, who was our conference planning chair for the 2022 annual conference. And, she was instrumental in getting our keynote speaker at the 2022 annual conference. And we were able to have a meeting with Winifred the day before that keynote presentation. And Jeannie, look at all of the doors that have opened.
Absolutely.
And, you may want to expand on that because that is very exciting.
It really is. And it shows you just how important we all are here within GAPNA. And like you said, you don't have to have some formal leadership title within GAPNA. We have been able, because of our contact with Winifred Quinn, to become involved with AARP and Susan Reinhardt. And that has really opened doors to us having great discussions about the COVID-19 pandemic as it pertains to our residents, as well as our frontline workers in long-term care, and how we can actually both prevent infection via vaccinations, as well as provide timely treatment for our residents who test positive for COVID-19. And we've been able to have discussions with the White House, and we've been able to have discussions with HHS. And it's really exciting because they're listening to our GAPNA members. And we had many members who participated in the AARP's listening sessions, really providing their input on what they thought were the important aspects of promoting vaccination within a long-term care facility. And like I said, it's just really exciting that they came to GAPNA and to our members to ask these questions and to look for solutions. And it's just, I'm so proud to be of an organization with engaged members and also members that are just willing to share and who have that expertise that these entities really need to hear from.
Absolutely. And over the course of the last year, we've also came out with 2 position statements related to COVID in long-term care. One talking about, we need to improve infection control practices, reduce those barriers for APRN practice, really advocating for full practice authority. And then we followed up with another position statement. So the one position statement that we had addressing nursing home safety during the COVID-19 pandemic and beyond, it looked at some of the core infection control problems in facilities. And that was actually followed up then with an invited article in the Jammed Up publication. And then most recently, Jenny, you served a central role in getting our newest position statement out about removing the barriers to practice in long-term care. And so it all just continues to propel us forward, giving us that momentum to continue working. And I want to thank you for, everything you're now doing there on the national level, again, trying to reduce these barriers so that we can provide the care that we've been educated to provide to our patient population.
Yeah. Well, Natalie, like you said, it's not just me, it's teamwork. It's funny because being the president of this organization, as I had said, when you passed the gavel over to me, it has been my professional home since I became a nurse practitioner. And so it's really an honor to serve in this capacity. And it's so much fun to be able to match some of our members with some service opportunities, given their expertise, given their availability. And it's been really eye-opening to serve also on the Health Affairs Committee. And I know that's a committee that you have served on for quite some time. But that removing the APRN barriers in long-term care, that position statement was really needed. And I like how it built upon the position statement that we had produced the year prior about managing long-term care in the era of COVID. But the exciting thing that we get to continue to bring forward is now we are going to be seeking endorsement of that position statement. So there's more to come. And I think when I have shared it with other people, they're really excited that it exists because the statement is very rich with a lot of data about how important APRNs are in long-term care. And, shifting the conversation a little bit, I wanted to ask you about the Health Affairs Committee. I know that being part of the committee, a toolkit just came out at the end of the year about advocacy, which is really great. And it's available to members and non-members on our website. But I was wondering if you could share with listeners what other things that the Health Affairs Committee has been doing within this past year.
That is one busy committee. Every time I sit in on a call, I'm in awe of the number of members that we have that dedicate their time consistently to sit in other organizational calls, coalition calls, the Nursing Community Coalition. It has 60-something nursing stakeholders, and we are one of them. And just in the year 2022, that organization alone sent out 29 endorsement letters to members of Congress on items affecting nursing. And many of those were related directly to older adults. And GAPNA signed on to every one of those letters. We also have members who sit in on the nurse practitioner roundtable calls that are twice a month. Those are calls where different nurse practitioner organizations get together and they talk about these core issues that affect APRN practice, specifically nurse practitioners. Leading edge and advancing excellence in long-term care, those are other coalitions. GAPNA members actually started a home care coalition that meets regularly. There's just always something going on with health affairs.
I agree. I have sat on that committee now. I think this is my second year, and I had been on it previously and took a little break, but it's always really so enlightening to see what is going on across the span of nursing and how Gero APRNs, how we're such an important piece of that. So thank you for all the work that you're doing in Alabama, your home state, as well as all the work that you're doing on a national front for APRN education. I know that I have benefited from it. I know that other people in our organization have as well.
Well, thank you, Jenny. And obviously, we are where we are now, thanks to our previous presidents, previous boards, who really fought to get us to the table.
Absolutely. Yeah. And I love how we continue to build. So, something that is coming up in just a few months, and I have to ask if you're going, are you going to the pharmacology conference in Honolulu?
Not only am I going, but my daughter is going.
Oh, wow.
And throughout COVID, for the past 3 years, she has said, COVID cost me a trip to Hawaii. So yes, we already have our plane tickets. I've already registered. I understand that registration's going well.
Yes, registration's going very well. A lot of people are planning on attending there in Honolulu. I'm going to. I am really excited. I have my plane tickets and I've registered. So my next step is to start mapping out all the things that I want to do on the island in the afternoons when we are not there in sessions learning about pharmacology.
And hopefully we will get to Pearl Harbor finally, because I remember last time in 2020, you have been so kind to, get a lot of tickets for people who wanted to go. And then, it got canceled due to COVID, but it's refreshing to know that after, this going through lockdowns and then just the fear of traveling. Yeah. Now that, even though we still unfortunately have COVID, it doesn't appear to be as deadly as, the first strain or two. And it's just good to know that we can get back together. They are live in conferences if we choose to do so and we feel comfortable doing that. Probably my most favorite memory during my presidency was just being able to go back to a live conference. And that was in San Diego in 2021, the fall of 2021. That's actually at that conference is when I became president. At that conference, of course, it was hybrid, but we had a total of 471 attendees. And many of those were actually there physically in the room so that we could get our conversations there going in the hallways. And then looking at the pharmacology conference last year in Philadelphia, it was hybrid again, but we had 454 attendees. And then at the Orlando conference, I don't know the numbers off the top of my head, but I know at each of these 3 conferences, we've had an increase in live attendance. And that's just good to know.
It is. It's really, really encouraging, especially since so many of us have been engaged on the front line with COVID these last few years. So it's encouraging to start to see that light at the end of the tunnel while we continue to vaccinate and to treat our patients with COVID. It's good to know that the end is hopefully maybe near.
I hope so. And And Jenny, I know you recently participated in a podcast with AMDA regarding the toolkit. Tell me a little bit about that.
So GAPNA partnered with AMDA and AANP and a couple of other organizations to produce the Vax and Pax toolkit. And I was able to participate with the president of AMDA as well as the president of AANP on a podcast that was introducing this toolkit. It's a great toolkit. It's available to members on our website. It is also available for those who are not members, but it's a great toolkit that really helps walk you through not only how to promote vaccinations, but also how to engage with other stakeholders there within your facilities and to improve the process of Paxlovid prescription. So it's an exciting way to collaborate with AANP and AMDA. And it was really just great to be invited to the table and to be able to share how our members are using it and how we actually foresee our members using it as well. One last thing before we close, something I'm really excited about for 2023 is our We Are Your People campaign. And it has already started on social media. And the national office is still collecting stories from our members. So if you're listening to this and you have a great story about how you fell in love with geriatrics or even what GAPNA means to you, please submit that story. But I love this campaign because I love reading the stories of our members and their journey into how they found geriatrics. And Natalie, I've known you a long time, but I don't think I've ever asked you, what is it that hooked you and why did you go into a world of geriatrics, especially in long-term care?
Well, Jenny, that's a really loaded question. I'm not sure I have a really good answer for you. I will say growing up, I was an informal caregiver for my grandmother, and she was able to live at home, but due to some mental disabilities, there was always a family member checking in on her regularly. And once I became 16 and could drive, it kind of got passed to me that was one of my responsibilities, and which was fine with me. I was able to go out and drive and go down and see my grandmother, who would, feed me fudge for dinner if that's what I wanted. And that's a true story. But when I was in nursing school, I really thought I wanted to do oncology pediatrics, and where I got that from, wow. But I graduated from nursing school, and I'm going to date myself here, but I graduated in 1985, just right after the implementation of DRGs, and many hospitals were closing their doors, and they definitely were not hiring nurses. And I was one of the few out of my graduating class who managed to get a job immediately. And it was on the vascular surgery floor of where I had actually done clinicals. And so almost all of the patients were older adults. They were having their FEMPOP bypasses or unfortunately amputations. They were having carotid endarterectomies and those type of procedures. And so I really just enjoyed taking care of them. And then I left that and went to work in labor and delivery, and I realized this is not for me. And so shortly thereafter, I did home health and seeing, Medicare homebound older adults. And I don't know, Jenny, I just fell in love with them. And then I was always really intrigued with nursing homes for some reason. And I remember I applied to work at a nursing home, and I was really disappointed as an RN that they did not call me even for an interview. And I was just crushed. And then later, when I became a nurse practitioner, and I worked in a geriatric specialty clinic for a while, and I would talk to nursing homes a lot. And then I later went out to a rural area where, to me, it was the perfect job. I was able to see clinic patients in the morning, then I would go see the homebound patients, and then I would end up at the nursing home in the afternoon. So I just really, in my young years as a nurse and a nurse practitioner, for some reason, I just felt like it was my passion and my calling to take care of older adults. And I've never looked back.
Yeah. What a great story. And, we're glad you chose geriatrics too.
Thank you. What about you? What brought you into this world of geriatrics?
You know, my parents always made it a priority for us to make sure that we were taking care of older adults who were isolated at home within our community. And, you know, I always felt very comfortable around older adults, just talking with them. I don't know what it was. I just felt comfortable and I enjoyed talking with them. I thought there was so much humor in that they would just say anything and really didn't have much of a filter. So there was the humor aspect of it. But I actually worked as a nursing assistant in a smaller long-term care facility and just realized this is what I want to do. I loved it. I loved talking with them. I loved taking care of them. It was just really, I realized this is my space. And then I loved the intellectual piece of it as well, because we know older adults are really a challenge to take care of with all of their many, many comorbidities. So like you, I found it and I just never turned back. And I cannot imagine any other job that I could love more than working with older adults, not only teaching students, but also working in a long-term care facility. I feel like, you know, I don't understand why people don't enjoy it as much as I do.
I know, and I'm also in academia teaching in an adult Gero nurse practitioner program. And it just always delights me when I get an email from a student who says, you know, I really never thought about taking care of geriatric patients, you know, until I had you and as one of my instructors, and I see your passion and I realize, you know, that there's opportunities there for me. And I'm sure, Jenny, you get the same type emails from your students.
I do. It's music to my ears. Oh my gosh. It's so great to get those emails knowing that the next generation of nurse practitioners are preparing themselves for a career working with older adults. I just couldn't want anything more. So.
Yes, and we hope that they will find us.
Absolutely.
You know, we have the student rate for students to join GAPNA this coming year, or actually it's now 2023. This year, we really are, the education and research committees are going to really try to emphasize student posters, doctoral student posters for our annual conference in New Orleans. And I had a meeting just yesterday with some of the members of the education and research committees. We are actually rewriting the call for abstracts for student posters.
Great.
And we hope that we will have more doctoral students want to disseminate their work via a poster at our conference, and there will be a monetary cash prize for the best poster in the student category.
That's great. I love cash prizes, and we know students could always use a little extra money. So that is wonderful. I am so looking forward to that. So that is in September 2023, when we're down in New Orleans, which will be here before we know it. It was so fun to talk with you, as always. And I look forward to seeing you live and in person in Honolulu in, gosh, just a few months.
And Jenny, I look forward to what all you will be achieving this year as president, and also helping just lead GAPNA and us implementing those strategic plans for our next 3 to 5 years. And it's just going to be a really good year for everyone.
It's going to be a great year. And I have been president for 3.5 months now, and I'm really enjoying it. It's a lot of work, but it's just, we have a great team.
We do. We have an excellent team. And also, I would like to also, you know, one of the things that happened last year is, because GAPNA is growing and because we are becoming so involved in so many different initiatives, we had to hire another person. We needed a second person. Erin McCartney, she just can't do everything. And I want to also, you know, just bring attention to Megan Cash. She is our member engagement coordinator. And I heard just yesterday from one of the GAPNA committee members saying how much they really appreciated all of the things that she is posting on the GAPNA exchange.
She's wonderful. She and Megan are that dynamic duo. I don't think that we could be as effective as we are without them. And of course, without the guidance of our executive director, Michael Brennan. So I love seeing us continue to grow. And I'm so thankful for, AJJ being such a great management company.
Absolutely. I agree.
GAPNA Chat is owned and produced by the Gerontological Advanced Practice Nurses Association. All rights reserved. No portion of this podcast may be used without written permission. Dr. Jennifer Kim is the current president of the Gerontological Advanced Practice Nurses Association and a professor of nursing at Vanderbilt University's School of Nursing in Brentwood, Tennessee. Dr. Natalie Baker is the immediate past president of the Gerontological Advanced Practice Nurses Association and an associate professor at the University of Alabama at Birmingham School of Nursing in Madison, Alabama. For archived episodes of GAPNA Chat and to learn more about the Gerontological Advanced Practice Nurses Association, visit gapna.org. You can also subscribe to GAPNA Chat on Apple Podcasts, Google Podcasts, Spotify, Stitcher, TuneIn Radio, our hosting site Spreaker, and everywhere podcasts are found.